Welcome to another episode of Fish Innovation. Really excited this week to introduce a new guest. So, we've talked a lot about before product strategy, innovation, focusing on a lot of SaaS, different kinds of technology, support partners. Today, we have a guest who's in the health tech space. Why am I bringing in health tech? Well, it's really important when we think about not just our businesses across, but how are we thinking about marrying the two up and in our different stages of life, or how are we thinking about personally ourselves? Well, today I'm excited to really get more into talking with Emily and Braided Health and understanding about what it is they do and why it's important and how to think about that. So, Emily, really excited to have you on the show today. Welcome.
Hi, Ben. Thanks for having me.
Yeah. Of course. So, just like every week, we ask people about their journey. Yours is, I think, really cool. And I think everybody really would want to hear about it. Do you mind walking us through sort of your journey and how you ended up at Braided Health?
Yeah, for sure. Been in healthcare for 20 years at this point. Actually came into nursing a little bit later, but always really was thinking about working with vulnerable populations, whether it be homeless. I worked in a long-term institutional setting for people with severe mental illness, and then decided that I wanted to kind of add to that. So went back to nursing school, managed a youth and adolescent inpatient unit for a while. But when I became pregnant, that was actually no longer safe for me. So I kind of took a little bit of a pivot and got into case management. I love the concept of looking at, what we might previously call a patient, and recognizing the human element and how there's all these different pieces that fit into their story. And not only was that important from, humanizing a patient, but it was also really important if we wanted to drive outcomes. We really need to understand what the true barriers are. And what we know now, but was more novel at the time, is that a lot of the times it's not the medical condition that is the biggest issue. It's really the Maslow's hierarchy of needs, which we now often called or are calling social determinants of health or health related social needs, but making sure that we understand that so that we can actually align the care with what the real issues are, and not sort of just play whack-a-mole by saying we're just going to educate this person or we're just going to do X, Y, or Z because that's what's evidence-based, but really saying what is the driver here and how can we think differently about this if we really want to get better outcomes, better experience by the people consuming services. So that's kind of how I ended up in 2015 in a startup doing value-based care. Didn't know what value-based care was, but thought, oh my gosh, there's a way where I can do what's right for the patient and be financially sustained. And that was really exciting to me because it really felt like a binary thing. Either I sell my soul and make a lot of money, or I do the right thing and I'm struggling to live day to day. And so when I recognized those things could both exist in the same place, that made me really excited. And I kind of early on decided, like, this is what I want to do because it makes sense. I feel good doing it. And I have the opportunity to really make a big difference, and not necessarily just one-on-one patient care, but by designing systems and changing the ecosystem, we really have an opportunity to create better experience for millions of people.
That's that's amazing. I love that you can create a win-win, right?
Yeah.
Can you talk a little bit about value-based care for those that might not understand it?
Yeah. So, what probably most people think of when they think of healthcare, we call fee for service, which means you go to the doctor, they get paid for seeing you. And what happens there is sort of inconsequential, meaning that it doesn't impact how much they're paid. And what we're doing in value based care is actually aligning incentives, meaning that when we do the right thing for the patient, so keeping them at home with their friends and family, helping them manage their conditions, that the money will follow, and that we're actually able to, when you think about healthcare spend, a lot of times, especially unnecessary spend, is happening when people are utilizing the emergency room because they didn't get preventative care, or they're going in to the hospital time and time again. And so those are the things that we think from a financial standpoint that we want to limit. It just so happens that those things are highly aligned. When you think about it, most people do not want to spend time out of their home, or they don't want to be waiting 8 hours in the emergency room for something that doesn't actually require emergency services. And so that's kind of how that works, so that it's really a win-win. That the health plan wins, the providers win because they're feeling better, they have more support, and then the patients or the members win because they're having a better care experience and that is more aligned with the things that are important with it.
Yeah. So are we seeing, so when we think of like value-based care, is that kind of the model that we're going to be seeing more and more often used today? Like if I'm, let's say I'm a small business owner, right? I need to figure out my expenses. ACA is extremely expensive. Maybe I'm not there yet to be able to have a large enough company where I can have my own private insurance. Is value-based care something that I should be thinking about if I'm maybe a middle-aged small business owner? Or should I be
Yeah,
doing
so I
something
think
else?
it's interesting. I think at the end of the day, yes, but what it's really dependent on who that small business owner is partnering with, because oftentimes it's the payer that's doing that. And so I think it's really interesting when you think about a small business where you're using like a third party administrator, and that's a little bit tends to be more fee for service. But I think there is more movement sort of towards that. There's some models where they're thinking about, okay, you just give an individual a certain amount of money and they can spend that money how they want. And that's one way of kind of like using a value based care mindset sort of outside of how it was originally created, or like the more typical payment arrangements that are happening. But I'm seeing more movement, startups in that space who are recognizing the value of being able to have more control financially in one space, but then also giving and empowering the individual to choose how best, along with their care teams, how best to use that money, which I think is really interesting and is kind of a spin-off that would apply to the situation you're talking about.
Okay. No, that's really cool. I know it's, as we think about things, healthcare is definitely a topic. I know in the last election, it might not have been as high up there in prior elections. We're talking about COVID for sure. But I know that as we start to think about things and folks maybe not even having jobs, right? They're still going to want to be able to get taken care of and all that. So it's really good to know that there's a different opportunity. How do you see the healthcare space evolving
Yeah.
from where we are
So
today?
I think one thing that a lot of people really like the idea of value based care, it's kind of a no brainer, right? Like this everyone wins scenario. But I think the big obstacle right now is, well, there's a couple of them. I think number one, understanding it theoretically and then willing to change a paradigm that you've worked in for decades is really difficult. I think there's some piece of ego when you come into a value based care, you have to approach it very differently. So it means, a nephrologist who has spent their career focusing on the kidneys now has to open up their mindset and understand and be willing to participate in some manner in how do we think about depression or these social determinants, because at the end of the day they are affecting outcomes. And so that's a big thing, is there's this change management piece that often is not totally recognize when someone's considering, like, do I want to kind of go into this new way of thinking and practicing. That often is some of the biggest barrier to making that happen. And the other piece is, though, although value-based care by nature is designed to save money, the reality is when you first are making that transition from fee for service to value-based care, there typically is a point in which you're actually having to devote a lot more resources, a lot more time. You have to like sort of get people into that space. And so what you'll see is that spend in the first year might actually increase, and then you'll see exponential savings over following years. And so that's another mind shift that has to happen for this. I do a visit, I get paid, versus I'm investing in something now that will pay off over time, which is harder to digest from a risk standpoint, even though it's well documented that that will happen.
Yeah. And I've seen that there are some folks out there you can actually be able to help. Totally different, but on the business side, they're providing services so that you can have your employees at your company get the healthcare services needed, and then even set them up for like the long-term care they might need. Even though there's a higher upfront cost, they're still seeing like potentially those long-term benefits. So that's really cool
Yeah,
that
for
you're
sure.
thinking about
And I
that
think that's
and
the
seeing that.
really interesting thing about the space that I sit in now. When you think about aging, that is something that affects everyone. I mean, unless you pass away early, but like this is something that transcends sort of this, a lot of when we think about different disease states and focus on that, people are like, oh, I'm not going to get that, or it affects, there's a lot of difference in terms of like marginalized populations who it might affect more greatly. But the reality is that no matter who you are, aging is something that we are all going to face at one level of another or another. And so thinking about this as a really interesting space to be in because everyone can imagine either themselves getting older, experiencing a parent getting older, or a grandparent or a neighbor. And so it's really interesting when you start talking to people about this space specifically. It's less of an abstract idea versus like, what if I get cancer or what if I get dementia? Like aging is something, and with that, the loss and independence is something that's very real for most people. Again, either they see it in themselves or family members, and then it has this sort of domino effect because once a parent or a grandparent, a lot of times the caretaking falls on another family member, and that has sort of additional economic impact because often they're having to sacrifice being at work and or that kind of thing, and or having to then pay someone else. And so this is a topic that really has this ripple effect, and is you start seeing whole family systems impacted versus just an individual. And then of course chronic disease plays into that, but I think it's a really interesting and important place to play because as we think about the boomers aging and this huge cohort of people, this only becomes more and more relevant over time.
Yeah, I think it's so interesting you mentioned that. I mean, if we think about maybe a century ago, even, it was almost commonplace to have the grandparents live in with the family. I know people, so like post World War II, there was a lot of basements in a lot of, so people moved to like the Midwest and other places, and they would build basements to have or another bedroom for the grandparents to live, and they'd have their own living space. It's kind of like an apartment within the house. And we saw that because usually there was a stay-at-home parent. Typically the mother would be the stay-at-home
Huh?
mother that would take care of the kids and the grandparents.
Yeah.
It could be most likely the in-laws, that you're taking care of. It was, from a social perspective, it was good, right? When your grandparents are, I guess, punishing you or talking with you, it's a whole different experience than, child rearing than your own parents. And so I think from that perspective, we saw that was really good and how those effects downstream. But when we look at today, the cost of living, right? Post World War II, great. I could buy a home. I could build a basement. I could build my own home
Yeah.
and build it up.
There
No,
is
I mean, we're
space to
looking
do
like,
that.
yes. I'm like, do I live in an apartment? I mean, yes, my spouse maybe can fit, but I'm definitely not thinking about bringing my parents or his or her parents over or to live with us. So we do lose out on that. But with technology and how things move, there still might be a case where grandparents still can be fully involved in the younger generation of the family piece. You still have that social element. But yeah, I mean, we can't do that today. So then how do we still enable baby boomers who are mostly grandparents today, and moving to those stages of life where there's going to be a huge economic and mental drain on people? How do we make, that transition easier?
Yeah, and I think this is where I get really excited about technology and AI. And one other comment I'll make is that sort of as we've moved away from multi-generational living and become more independent, that independence loss becomes even more important. But then the other thing that is sort of this thing that's happening in the background is this epidemic of social isolation. And so with families not only not living in the same homes but living across the country and things, we see this other piece, which is social isolation, which is really interesting because in a lot of the ways that we're thinking about solving this problem we're talking about, it's with tech. And so the thing that I think we need to be really careful about is that we don't, do something that is going to, sort of create a solution in this one very specific area, but then actually create deficit, which actually could actually increase unnecessary utilization. And because they may have been using the ER for medical reason or physical reasons previously, but now they're desperate to get interaction with humans, and so in a way that can also actually drive increased utilization. So it's not just something where we can just sort of slap robots or AI agents on it, but there is really interesting opportunity for us to actually use AI to gather the data and figure out what are the right interventions for this one so that we can make sure we're not just sort of like saying, oh, we're going to reduce cost and then in 3 months we're actually going to see a spike here. So being able to think about that bigger picture and be really intentional about the use of AI and tech. I'm all about using that to actually improve the human relationship in addition to clinical decision making and using algorithms to determine what those are going to be. And then having that all support a more informed, real connected relationship with their care team is how I think about walking that line.
So are you thinking, with the AI, so as a communication tool, so I'm just kind of putting a use case around this. So let's say, it's time, you're in your middle age, your parents are now getting to that point where it's probably time to move out of their house. They're going to have to move in with a care team. You're not from the healthcare sciences side, right? You sort of understand your healthcare system when it comes to you, but you're not really sure what it means for these octogenarians or even, retirement age folks. Like, what do we do? And so today it sounds like there's a lot of miscommunication or understanding, at least from the family side, from the caretaker, and sort of how do you figure out to bridge that gap? And you're saying AI is doing that. Can you kind of talk to an example of how we might think about that today?
Yeah, so the way I think about it is often when we go into a healthcare provider, I'm sure you've had this experience. They say, okay, I don't know if your blood pressure is high. I mean, you in general, but like your blood pressure is high, you're borderline diabetic, we need to reduce your A1C. And these are the types of conversations that are happening. And you can probably rationally understand like, okay, need to get better numbers. But like what we are often missing, and I think this really speaks to this sort of like, communicating without understanding. And so thinking about how could we have that conversation differently if we know that this grandparent, like their sole goal is like, I want to be able to get down on the ground and play with my grandkids. That helps my daughter out. She does a lot for me, and then she can go on a date or whatever. This is like really what people are thinking about. And so I think it's our job, and we can use AI to help us do this, to say, hey, I know this is really important to you. Like, let's talk about these things in your health that might be getting in that way and what we can do about it. So you come around to the same thing, that you need to lower your blood pressure, you need to get diabetes and diet under control, but you're coming at it from a way that's actually intrinsically meaningful to the person, and therefore the family's going to understand that as well. And being able to talk to people, and instead of trying to work against them, oftentimes I found myself in conversations where we're trying to figure out how to get someone to do something that we wanted them to do. And I really want to flip that script and say, what do they already want to do, and how do these things that we want them to do align with that? And let's talk about it like that, because at the end of the day, we're still managing the blood sugar, we're still doing lifestyle changes. But when we're doing that because Mrs. Joan wants to get down on the floor and play with her grandkids, that's a very different conversation. And that's a very easy thing when you think about true engagement and activation. If that's already something they stated they want to do, the likelihood that they're going to follow through and do whatever they need to do is much higher than sort of some abstract number or testing that they're doing.
Makes total sense. I mean, you're taking a lot of the burden off the provider. I mean, probably the provider would say in the bedside manner, I'm not saying all doctors do this, but they'd be like, you need to get this under control, or do you want to
Yeah.
play with your grandkids? You got to
Yeah.
do
Or,
this.
you're going to get an amputation, which is important to know, but like it's a scare tactic. And until they are able to put together, if I'm amputated, that's not only time out from recovery, but it also means the likelihood of me getting down on the floor is somewhat decreased, right? It's going to make that thing harder. And that's just a very different way of thinking about it. And from a trust perspective, I'm going to trust someone who is like on my team and helping me do the things I want to do much more than someone just telling me about me. I want to be seen as the expert. And I think most people do about themselves. And so when I feel someone is listening, then I think it also creates a space where we can have harder conversations about risks. But because we've sort of put the work in previously and they know that we're doing it in the realm of what's important to them, I think it creates a trusting relationship. And I think we can use AI to help us remember, hey, they said last week that missing their grandson's birthday was like one of the worst things ever. And they did that because they're in the hospital. And so we can absolutely use that as leverage and common ground to help progress together. And I really like this idea of making the patient or the member the driver of their care, not just like we talk about person-centered care, but like if you're in the driver's seat, I think you're setting the course. There may be like different roads you can go down to, but and we as healthcare professionals need to give you an understanding of where those roads lead, but ultimately the destination is your choice. And I think that's a very different way of thinking about healthcare, but one that we need to consider if we really actually want things to be different. And I think it's really interesting in the political landscape as well. Like there's lots of different things, but the one thing that I think is consistent is we have to be able to do better. We have to have less wasted, both through fraud, waste, and abuse, and through redundant, siloed systems that aren't talking or collaborating. And so I think this is something that sort of one of the few things that I think is like transcending the political landscape at the moment.
Yeah, I mean, I mean, I think this really works. One, because I've seen it myself. I know there's a lot of companies that are, well, I shouldn't say a lot, but there are companies, startups out there that are looking to increase the engagement.
Mhm.
I call it like patient engagement. So
Yeah.
I was talking to a rheumatologist a little bit ago. She said probably of all the patients she sees, less than 30% actually follow the plan of care.
Hmm.
I'm like, that's nuts. So you're telling me that only one out of every three people you see basically is listening to you. And she says,
Yeah.
yeah, and the other two just keep coming back and we have the same conversations
Yeah.
over and over and over again. I'm like, that's a lot of waste from an insurance
Yeah.
standpoint, your time, their time.
Yeah.
And I said, is it that the fact they just don't understand this stuff? She says, I don't know. So we put in a messaging system that was just like, hey, it's not just here's your report for the day, go ahead and read it and have fun. It's more about here's what we're doing and why it's important. And if you have questions, here's how to follow up on that and get those questions answered. And then if there's anything going wrong medically, right, that's when you want to reach out to me. Otherwise, this messaging platform should be able to help you understand it. So she saw that low 30s up to over 68% now. So
Yeah.
almost two out of every three are listening just by having that. And so with what you're saying, now that you can communicate even more personalized, right? It's about what are their goals as opposed to why is this important? It's, well, why is this important to you, not to
Yeah.
everybody else, but to
So
you
that's like the
personally?
next step in what you all were talking about. And I think the thing which may be controversial is we have to stop asking the question, why aren't they listening to us? And start asking the question, why aren't we listening to them? They are giving us clues all day long that they're not going to do, yet we think the right thing is to push forward and it doesn't move results. So I think like the thing and that is ingrained in the medical community from the get-go, right? Like you have to have the answer, you have to fix this problem, but we have a lot of these tools and data that we do not consistently use that are actually giving us the answer. I would sit in interdisciplinary team meetings about someone who's going, they're not going to dialysis. And one of two things would happen. A, they gave us very clear information that they don't want to be hooked up to a machine 3 times a day and that quality of life is more important. And we didn't listen. Or we didn't listen when they said that their car barely ever works. And so, of course, they're not going to get to dialysis because they can't. And so, like, those are the things that, like, I saw it on your face. As soon as I said that, you're like, of course. But, and it seems silly, but we are so often focused on treating symptoms and, setting a particular path in motion that we miss really obvious things. And there's a lot of good reasons for that. There's 10,000 different things we have to do or that are happening in our head at any moment, even in a patient conversation. And that's another place where AI can say, like, hey, did you hear that? Did you hear that they said X, Y, or Z? And like just being able to surface that, we are not telling anyone what to do, but at least we're making sure that someone knows that that is a thing, and that we can use this tech to, like, say, like, the Jiminy Cricket on your shoulder, like, hey, did you hear that? Did you see that? And the answer may be, I did, and I chose not to go down that for a particular reason. But we're sort of taking away that opportunity for something to be forgotten or overlooked. And I think that's super, super exciting as well.
Yeah. Well, it honestly, what I'm hearing is you're taking a lot of pressure off the provider, that the provider
Yeah.
can focus on his or her job. And now instead, because I've talked to a lot of providers, you're right, treating symptoms is they're like, I don't have time to dive into this case. They're in pain. Let's solve that. I'll get to it later. As long as they're feeling good, then we can worry about it later. There's a problem with that. Usually our pain receptors tell us there's a more deeper problem. It's just our alarm system telling us, hey, go focus on this. So if we just
Yeah.
mask it, we're not gonna get there. I mean,
Yeah.
so it's really this is gonna allow providers to be able to focus in on, okay, I heard what they're saying. I hear that. I can treat them with symptoms, but I'm also hearing my own AI,
Uh-huh.
given the two AIs be talking to each other, not just what it is that's happening, but maybe I want to investigate further. Then I can help translate that, whether it's my AI or their AI, being able to say, okay, we're going to run this test or we're going to do this because this is now what's important. And
Yeah.
I know you're in pain. I know this is for the meantime, I'll give you this so you don't have to be in pain, but this is something we do have to pay attention to. And you need to pay attention to it as well. And here's why. And then to your point, it's not just so the doctor's able to get across why it's important and urgent to take care of, but then the AI is translating. And by the way, this is going to help you with your goal of ensuring that you're down on the floor with your granddaughter,
Yeah.
or
And
even
not
if you're
because you
not,
fell.
yeah. And it's interesting, and I think a lot of in today's day and age, we ask the patient to be the self-advocate, but how? Right? When
And we
they
don't give
don't
them the
been through
information either. We often give them the choice that we think they should make, and we kind of skip over some others. But I think that is a big problem. We see that a lot in the home and community-based services where we're focusing, where people say, yeah, I want a personal care attendant. And when you ask, a couple levels deeper, they say, well, no, I actually don't want someone in my house. I don't want someone toileting me or seeing me naked in the shower, especially a stranger I've never met. Would I like a sliding bench chair? Because my problem is I can't step over the lip of the bathtub. Not that I
Yeah,
can't shower myself, but we don't look at that nuance. And, obviously having a sliding shower chair for the right person is much more cost effective and, you know, supports that bid for retaining as much independence as possible. So that's like where you can, especially when you're able to use AI to look at a lot of data quickly, this is where you can arrive at this pretty quickly. And, I've had lots of conversations with folks who are like, well, I said I wanted this because I thought it's the only way I could get my laundry done. I didn't realize I could have my laundry sent out and come back folded. That's all I need. And from the care team side, often we avoid that because, the benefits are different from state to state. They have a financial maximum, and we don't want to promise them something that we don't for sure know, or we have to get medical authorization and we're not sure if it's going to meet. Like all of these things play in. So we just kind of start building a default pathway of something that's good, but it may not be the best. And that's the other place where AI is far better than any of our brains at being able to look at, 10 years worth of medical data and distill that down. What have we tried before? How have their goals changed? What does this all mean? And then the other piece, as we're talking too, oftentimes we are having the same conversations over in these different, so the PCP or the provider may be asking these things, and then care management and they're answering the same questions over and over. And that's again wasted time. And so figuring out then how do we use this to like say, I'm a care manager, I'm getting this great information. Here's the small segment of that that is really important to the PCP that's going to save them time and help direct their care, and they don't have to start over. And then the real beauty is that value based care allows us to say, the physician may not have time because they're on a value based or a fee for service standpoint. So they need to do X number of visits per day to make money. But when you switch that and say keeping them out of the hospital is actually how you get paid, then all of a sudden having a longer visit makes sense and becomes financially viable. So that's a really important piece. You can't have sort of this change in mindset without the collaborative change in incentive and payment because at the end of the day, no money, no mission. We don't like to talk about money, but it's real, and people have to keep the lights on. They have to stay employed in order to do any of this. So all of that kind of has to happen at the same time in order for this to really work.
Yeah, I agree. I mean, I think we tried solving for it a while ago with electronic health records. I mean, we still have an issue today. I mean, this is a great stopgap already with AI to say, look, my records didn't transfer. If you go to one provider to another, a specialist, the specialist is like, I don't know, we're on different systems. So can you
Yeah.
give me your entire history? Talk to me. And now you have an entirely different way of dealing with something. And then you're right, it could get to that point where it's let's use a sledgehammer to solve their problem when I could have just used like a fine ballpoint hammer to
Yeah.
get what they needed done.
Exactly, and we have like we used to not have data. Now we have so much data, but it's never in one place. So the PCP usually has their records and maybe a few consult notes, and then the specialist has
Mhm.
their records, and then, it's like we are trying to effectively manage care that we don't have the whole picture for. And that's upbraided when we realize that like we have to start with getting the data in one place before we can do any of this other stuff. And so that's just like creating a receptacle so that we can pull information from all of these to get that holistic picture that we kind of started talking about at the beginning. But that has to be the first thing because otherwise you're trying to manage someone knowing half the story at best.
Yeah. Well, also at the same time too, I'm just thinking, and I'm sure you guys do this, is being kept up to date too, right? Like we're all busy. We all have, I mean, and you want to be able to give that attention to your parents or to your loved ones that you're have in this care team. Yeah, there could be a lot, and you're asking each caretaker the questions, you're trying to piece everything together, but now you have a way to sort of get, I don't want to call it reporting, but you get
Yeah.
this messaging that's very clear and action oriented that really says, you do need your decision on this, or this is what's happening.
Yeah.
And, how do you want to handle it? And now
Or here's what your
you're kind
your
of
mom wants to do, and here's your part.
yeah,
Instead of like spending the hour bathing her, we'll get, technology, or we'll get the sliding chair in, and now you're coming and you're doing an hour of relationship building and socialization, and that's a role and that's enough. And so like also giving some of those caretakers some relief in areas where they can have help, but then allowing them to, the time they are spending with them, doing it in a way that feels more meaningful and still knowing or having that confidence that it's a needed thing and that it's not just visiting and it actually has a really important impact on the health of their loved one. So I think also under being able to say like, here's the bigger picture and here's how each like entity, both the patient, the caregiver, the family, the health care system, here's how each of those need to play in to move towards this so that we're not like, over here saying we're going to work on this and over here saying, but like understanding the big goal and then having a really good roadmap. How does each different entity play into that to make sure we get there? And I love the idea of that too for everyone involved.
yeah. And at the same too, I was just kind of thinking, not just the sharing of data, but also the playbook for the care team too. Like we know that it can be more cost effective to have sort of a rotating system. I mean, not everybody has the luxury to have like one head caretaker that knows everything and lives with the person and all that. And especially if that person takes a day off or gets sick, now somebody new comes in and has no clue what to do. There's not that
Yeah.
consistency there. This way, you've got this playbook where almost anybody could step into the role and help as long as they're vetted appropriately, of course. Like
Yeah.
they can step into the role and they know exactly what to do, how to be caught up, to make
Yeah.
those. relational connections right away, right? I mean, that's
We
if
we
you have a
built
new
a
caretaker, you
digital
want
case
that.
sheet. So you're an on-call person who's never talked to this person. You're still going to know what their goal is. You're still going to know they have 3 cats that they consider their children. You're still going to know that social isolation is a big issue. Like making sure that no matter who steps in, you really are able, I think about it in 45 seconds or less to be able to get the right information. And the right information, I don't want to be talking about medication changes to the caregiver necessarily, like that should happen. I want to be telling them they had a medication change, watch out for this. And so making sure not only that we have that, 45 seconds, I'm pretty keyed in, even if I've never met this person about what's going on, but also making sure it's the right information for the receiver or the reader. So if you're a doctor, that's going to look different than if you're a CNA, or if you're a care coordinator, or if you're a family member. And I think, it all needs to lead to the same place, but saying, what are the issues, and what's your role in moving this forward? And then, what does rheumatoid arthritis a diagnosis mean to one person versus another? It might be a medication change for a doctor. It might mean making sure they're getting up and walking consistently for the caregiver, but both important. And so I think that's huge, because we know that exactly your point, there's going to be a rotating cast even in the best scenarios. And so how do we create that continuity across all those different stakeholders without requiring a ton of effort or asking them to read through 75 pages of medical records, 90% of which isn't really pertaining to them or meaningful?
Yeah, and I mean, I could just this is it's so interesting that for right now, it's just in the elderly care space, but you can see this model applied in hospitals and saving, I mean, not just lives, but like just think about it if you've ever gone in for a surgery or something where you've had to stay longer than you normally have. How many times do they have a shift change? And then, it was miscommunicated in the computer, or one nurse told you one thing and then another nurse comes in and does something different. And
Yeah.
then you go, wait a minute, the other nurse said that. Well, I'm the nurse. Listen to me. This is what you need
Yeah.
to have versus like, okay, we talked about all this. We know about this person's background. We have it. And then they also have an AI who's going to help explain on behalf of the new nurse. It's like, oh, the doctor changed what it was, realizing your results. So it might not have been effectively communicated to you, but I'm communicating it now, which is why we're doing it. So there's less like, so it creates more trust of the caretaking team and their ability to do their job than having to second guess a hospital system that is not following the directions or rules or leads to
Yeah.
liabilities.
Yeah, documentation is huge, because even if, I would say probably more often it's not that they didn't document it well, but it's that they're not going to be done documenting by the time the nurse comes on shift, because they're doing patient care. And then often at the end of their shift, after they've signed off, that's actually where they can sit down. And so I really want to think about, how do we get the right documentation just by people doing their job? And like, so if we're recording conversations with patients and it's summarizing, so it's happening more or less real time, and then we can go back and edit it, information is there, and you have a jump start, so that we're not seeing sort of this phenomena of people documenting late at night, long after the actual interactions have occurred, but more just by doing what they should be doing, we have that appropriate documentation. Because that's a huge barrier. Even if you have great documentation, the timing of it, because of how like productivity expectations and such often happening real time is very rare. And we have a lot of opportunity to use existing technology. We use it all the time in business for recording our meetings and action items. And there's a really big opportunity to use that in an intentional way. It still has to be reviewed. We can't just rely on it, but it speeds up that both the speed of documentation as well as increasing the quality at the same time, which is again one of those win-win situations.
Yeah, I mean, and the ability to be more accurate. I mean, not just. I mean, a lot of people might think of documentation as, oh, they're just dictating, and and then AI is just a dictation machine to take down this so they can do their job easier. It's not that. It's, remember, it's a brain that's thinking about things. And so if you take, I remember a long time ago, I used to volunteer in the hospital when I was an undergrad, and still today, this one doctor said to me, healthcare, being a doctor, I call it the art of science, right?
Yeah.
So you've got all this data and information, but you're still an artist at the end of the day. You've got to pick and choose what it is that you want to go and how you want to do it, which is why not all the time will doctors have the same opinion, which is why you're told
Yeah.
to get a second opinion. So what AI is kind of helping is it's not compensating the doctor or putting negatively the doctor's comments aside. It's more allowing the doctor to say, here's all the information. I know you might have gone down this one path, like, oh, this is what they've got. This is how we're going to solve it. It's like, well, start thinking about there are other things that could be happening right now. Just like
Yeah.
you mentioned, and they also said this, it's marrying up the two, like, okay, how can I create a win-win? Right. And, not just save the patient, but also save the patient effectively and feel that the patient, gets it in the way that they need it best so
Yeah.
that
And
it'll
I think we're
be an act.
also minimizing a lot of times I think when we have differences in second opinion, it's because we have differences in information used to make that opinion. And so like what we want to do is it still can and should happen, I think, with the same information. But if we can create a system that everyone has the same, wide variety of information and are starting from the same inputs, I think that actually really strengthens the opportunity to say, okay, now we can kind of eliminate the possibility that the difference in a opinion or diagnosis was simply because they were basing it on different information. And then I think it becomes a much more we spend a lot of time sort of chasing the why. But I think if two people are coming to different opinion, that leads to a much more productive conversation than when you have this argument that actually kind of goes like this because we're not even talking about the same thing, or there's a key piece of information on one side or the other that was left, or the way that someone talked about it was different from one provider to the next, which is, I think, a huge part of that. But that could just mean the disagreements would be more productive and meaningful instead of just like spending a lot of time only to realize it's because you were talking about two different things.
Yeah, agree. And I think it's just amazing what the capabilities are. So I know we're, running short on time, but is there something that we haven't talked about today that you really want to make sure that folks knew or how they can think about this today?
Yeah. So I think like at I see a lot of posts by providers really sharing concern and fear around AI in that it's going to take over and we're just going to be, having doctors and nurses that are robots and the profession's going to dissolve. And they're rightfully very fearful about that. I think that not a binary thing. And I think there's a really awesome opportunity to really improve the lives and experience of everyone involved with AI. And it has to be done in a very intentional way. And there's a lot of people, I'll say it, in the startup space who want to replace humans with AI. And I think it's not going to not impact anyone. But when you think about the caregivers, there's an opportunity to use AI just to strengthen, make sure you have all the right information, reduce the likelihood of errors, but still allow you to be using your gut instinct or the gestalt or the art of the science in better ways. And basically, the way I see it is there's this amazing opportunity for all of us who are in healthcare to be spending more time doing what we want to and what we train for and less time, doing non-value driving activities, documentation, checking boxes, and to kind of return medicine more closely to the reason that people want to do that and caring and nursing. And I think yes, is there a potential that it starts reducing FTE needs because we're driving efficiency? Yes, but that doesn't mean that we don't need nurses and doctors and all the other folks. I think that's really, really important. And it's important to get buy-in from the clinicians to do that. So, that's a huge piece we can't ignore. And to have clinicians involved in the creation of this is something that's really important. You need tech and you need data scientists and you need software developers, and clinicians should not be sort of a last minute check the box where we got someone to respond, but it should really be driven by them if we want people to actually use this stuff.
Yeah. No, I agree. We're not at the point of some of those futuristic sci-fi movies where a person climbs into a chamber and all of a sudden their hand
Yeah.
regrows or
Yeah.
they're all healthy again. We still need intervention from folks in the healthcare field that know what they're doing, that went to school to learn this and practiced it so we could do better. For the show comments or the show notes, would love to, give resources or people insights, whether it be braid health or some of the concepts we've talked about. So you'll give me relevant ones and I'll put that in the show notes for people
Yeah.
to do that. Is there, anything else or any other resources, you think people
No, if
should
if
know about?
people want to know more or ask questions, I'm always open. I'm on LinkedIn, or what have you. So I love, even if it's, it doesn't have to be an official reason. If you're just curious, so you want to know more about what we're doing at Braided or kind of in the health space, would love to talk to anyone. And so feel free to reach out or connect. The more the merrier.
Yeah, I mean, I think that's great. You're being open to people to have this conversation because I think we don't really know about it until it does happen. And
Yeah.
regardless, we should be thinking about ourselves too, not just our parents, right? But we should, there are things. How can we make with everything that's going on in life? How do we keep that balance as well and make it a little bit more streamlined and efficient? And I think talking with Emily would probably help you figure that out. So
Yeah.
Emily, appreciate you taking the time out of your day to come and talk with us. And I'm excited about the future of healthcare, and I feel better if, the time comes where my parents or my in-laws, like I've got, the right information out there and so excited to have met you.
Yeah. Thanks so much for having me. This was really fun.
So for those out there, again, you can reach out to Emily on LinkedIn and we'll have that in the comments and as well as the show notes. You can make sure to connect with her and ask her your questions. This is such a great conversation today. I'm so happy that everyone could learn about this and be able to become more of an advocate for your healthcare and for healthcare of others. So with that, you guys have a great day and keep on innovating.